Hello, I'm Darcie, and I'm making a video on jaw surgery, specifically the one I'm having done in August. Now, you're probably wondering why I'm making a jaw surgery video when there's so many on YouTube. Well, I figured I'd make one because this past year I did a research paper on the surgery I'm going to have, and YouTube did help me a lot with just experience and different people's stories. But one thing I did notice is the surgery that I'm having isn't really explained on not Facebook, on YouTube. Now, of course, there's a lot of videos on if you have an underbite and the surgery that goes along with that, and overbite. But every overbite video I've seen is not really as deep as mine. My overbite is 1 centimeter. That is pretty long. A lot of the videos I watched, they were millimeters, and I was just like, oh dang, maybe mine's worse than I thought. But with everything that I've been told, it doesn't really seem like any of the videos matched it. As you can see, I have braces. I've had them on for about, well, 2 years in August. So, had them on quite a while. My teeth are pretty much straight. My front tooth is fake, however, so there's been a couple complications with that. But just to show you how deep my underbite actually is, when I smile, I said underbite, overbite, is when I smile, you cannot see my bottom teeth. I can fit about a finger width between my bottom and front teeth. So, obviously, like I mentioned, I'm having the surgery in August on the 14th. And it's being done at the University of Michigan Hospital by Dr. Edwards. He's a great guy. He, when I broke my nose freshman year, I'll be a junior this year, so yeah, freshman year, he went in and did the surgery for that. He did a great job. Real nice guy. But anyway, along with that, upon meeting with him talking about my surgery, there is the normal discussion of risks and whatnot and blah blah blah. But one thing that I found interesting is in the jaw surgery, they're only breaking my bottom jaw, and they're cutting at the joints of my jaw, and bolting it back together with titanium plates. Kind of scary. Well, that's fine and dandy. That's usually how jaw surgeries go. Luckily, I won't have to be wired shut. They will be banding my braces together, my mouth closed, which I have to go and get hooks put on for that. But then he went to talk about the Genioplasty, which is surgery of the chin. Well, if you cannot tell already, I have a very prominent chin. Lucky me. And a lot of people who have severe overbites really don't have much chin or that facial area. It kind of just slopes down. And I don't have that. Thank you, genetics. So, like we mentioned, like he told me, the jaw would be moved forward. But he also mentioned that my chin would become more prominent because it would just be pushed out. And I said, alright, well, personally, I'm not a big fan of my chin. It's very bleh. And then he mentioned something that I've thought all along. He said that after moving my jaw forward, my chin would look more masculine. And no lady wants to look masculine, right? So what they're doing is he's sawing my chin partially off to soften my features. And never really seen this anywhere in my research. So I don't know if it's just kind of a makeshift, we're gonna fix it, or just nobody has mentioned it. So that I'm kind of worried about. But yeah, I'm excited. I cannot wait to see the difference. I can't wait to be able to smile. Although, I mean, it is my face, the outcome. Oh, well, I mean, putting a lot of trust into this guy. But hey, he didn't mess up my nose, so yep, we'll see how it goes. Feel free to leave me any questions. Like I said, I did a research paper on this, so I know quite a bit, and I didn't use any fancy terminology because I didn't want to throw you off. But yeah, feel free to ask me anything, and hopefully I'll be posting more. I'm gonna try to get someone to videotape me after surgery so you get to see me all poofy and gross. And I'll definitely do an afterward, because come on, who doesn't love before and after pictures? Well, thanks for taking time to watch this video, guys. I hope I can answer your questions, and hey, maybe I'll even find some people out there going through what I'm going through. Thanks.